Good morning and welcome to Living Local 15. Thank you so much for tuning in today. First up, it's Mental Health Matters with Viking Psychiatry, and we're learning about gene testing and how that can help you better understand your mental health. Then we are celebrating our 2024 Remarkable Woman of the Year, Dr. Sherry Franklin. And later, it's Medicare Because We Care with Health Markets, and Kevin McIntyre will be answering a question from our viewers. And a little bit later, it's epic discounts with really great prices. So stay tuned. That and more happening now.
Fashion, food, and fun. You're watching Living Local 15 with your host, Jessica Williams.
This segment sponsored by Viking Psychiatry. Welcome to Mental Health Matters with Viking Psychiatry, and joining me today is Sean Goddard, who is the owner. And today we're going to talk about something very interesting called gene testing. Hello, good morning.
Good morning. So good to see you again.
You too. Okay, so gene testing, this is something that you have offered, but this is our first time talking about it. So give us an overview. What is gene testing?
Yeah, so to simplify it, it's a snapshot of what works for you, right? Far too often when it comes to the psychiatric field, I often tell people prescribing medications and providers in this industry, sometimes it's like throwing a dart at the dartboard, right? You have all these darts to choose from. You pick the one that looks the straightest, has the best feathers, right? And you throw it and you hope you hit the bullseye. But far too often we find that it's not hitting the bullseye. And then it's throwing another dart and another dart. And so what GeneSight allows us to be able to do is actually look inwards genetically and see a couple of different things, anywhere from the type of medication that might work best for you to also some gene expressions and how they can present in mental health.
And so how does this correlate with mental health? Because you're right, you wouldn't think, oh, well, let me get a gene test to see if I have mental health challenges. So does it really show what your challenges could be, or just get a better understanding of how to best diagnose those challenges?
Yeah, so I think all in all it comes together with the idea of what could best support you on your road, and also how there could be some opposite changes in response. So regretfully, there's no testing out there as far as genetic testing, blood work that can tell me you have depression, right? Or you have bipolar disorder. Although there is something in the works there, there's nothing that's readily available to say this is what you have and we can tell that based off of your genes. What this gene testing does is look at, for example, let's say you're struggling with depression. It will take every single medication that's available in the mental health field for depression and show us where your body lines up in usage of those. So do you absorb the medication correctly, break it down correctly? Are your levels going to be correct when you take the medication? Or are you more likely to have increased side effects? Or are you more likely to not respond to a medication? And so it gives us that in a snapshot. And for multiple, it shows us for depression, anxiety, ADHD, sleep, and some other options that are available there as well.
Yeah, that's really cool. It sounds like it's like indicators, right? That kind of just goes through and kind of marks to give you a better understanding of what's happening in the brain or in the body rather. And I know that you have some really cool brain products that we talked about before that allows for you just to get a different synopsis of just where someone is to help them with treatment. And so if someone does need to get a gene test, is there an order that's involved with it?
Yeah, right now at this time, for a long time, insurance companies were very unfriendly when it comes to gene testing because, of course, like anything, when it first came out, it was very expensive. And so one of the requirements have been that you have to have a provider see you and sign off on that order to get it done because the insurance companies can request the record and check whether there's medical necessity is what they like to say, right? It doesn't matter about your necessity, your needs, on whether it's a medical necessity that they pay. And so while they have gotten more friendly and have reduced restrictions, it still does require being seen by a provider to sign off on that order.
Okay. And where does this fall in the mental health timeline, right? So if someone is feeling that they may be suffering from anxiety or depression and they may go to a physician to try out medications, do they do the gene testing first or do they do the chain of medications? Because I know that your services come after
several medications do not work for them. So where does the gene testing fall in that?
Yeah, so I would like to say that it should fall at the very beginning, right? Because it sure would help to have that better understanding straight from the get-go, right? It's kind of like knowing who's going to win the Super Bowl beforehand with just a slight variance, right? You want to know, right? And so I would like to think that it would be at the very beginning and help reduce the burden and the load that people go through in treating mental health disorders. However, number one, not every office offers it, and some of the insurance companies do require that you have failed a couple of medications prior to them being willing to pay for it. So at Viking Psychiatry, one of the things that we offer is we offer the traditional gene testing, and there's 2 companies that we use, but we also use a third company that offers what would be considered a low for gene testing cash price. So if there's somebody that wants to get the gene testing before they go through trials, then they can get that if their insurance company wasn't going to cover it because they haven't failed medications to meet necessity.
Okay, so Viking can assist people in meeting that criteria?
Absolutely, and getting that done, we absolutely can. It's, we talk about the whole picture and looking at everybody individually and tailoring a plan to them. And gene testing really ties into creating that tailored plan, not only in regards to medication, but for example, there's a test that's part of that looks at something called MTHFR, which is a deficiency in folic acid, which there's a lot that goes along with it, and I could geek out for like 20 minutes about it with you. But in the end, it helps show whether you're making enough neurotransmitters in the first place. Do you have enough serotonin, norepinephrine, and dopamine, and glutamate? Let's not forget glutamate because it's so important. But it shows whether you have a deficiency, and if you have that deficiency, it's very easy to treat. And so it can make a significant impact and potentially reduce or eliminate the need for medications or the dosage of medications that you're on.
Oh, I love that. That makes a lot of sense. So see where you may have a deficiency, help that before going into more serious actions. Great.
Correct.
Awesome. Well, thank you so much, Sean.
Thank you so much. So good to see you again.
You too. And if you'd like more information about gene testing, this is something that Viking Psychiatry offers. We'll have their website listed below. Give them a call, and I'll see you after the break.
This segment sponsored by Viking Psychiatry.
Have an idea for the show? Want to find out how you can be a guest? Contact us at livinglocal15@wayne.com.
This year, WANE 15 awarded our Remarkable Woman of the Year to Dr. Sherry Franklin. This woman has exceeded so much in her career and personal life, and I'm so thrilled to chat with her to learn more about this remarkable woman. Good morning, doctor.
Good morning, Jessica.
How are you doing?
I'm great.
Good. Well, I'm so thrilled to have you here because this award is so meaningful to our community, to this station, and you are the Remarkable Woman of Northeast Indiana. Yay!
Thank you. Thank you.
Yes. So let's start off by getting a little background and history about you. You are a family physician, and I know that you have been in this career for quite a while serving. And let's just talk about, how did you become a doctor?
Well, if we go way back, in the 3rd grade, I did a science fair experiment on the kidney. And my dad, who's also a family physician, brought me home a model of the kidneys, and I talked to him every night, learning all about the kidneys, how they filter and clean the blood. By the time I did that science fair, the judge said, you know everything, and that was it. I won, and that was my interest in science right there.
Wow.
So you can never start too young.
Right. And so with your father being a physician too, you followed in his footsteps. And this is something that's so nice to have a multi-generational career path.
True.
And you took it up a notch by really not only being a physician, but also being an incredible mother of 6. Which is incredible.
Sounds like a lot when you say it.
Right. So how is it being a mother and also balancing your career?
I think that's what makes me a better physician, is that I am a mom, because I sort of coddled my patients like they are my children.
Yes.
One of the things I say I'm a CEO, not a chief executive officer, but I'm constantly encouraging others. That's what I do with my children. That's what I do with my patients. I like being that cheerleader. So
Right.
that's something that I've always loved.
Oh my goodness, that's incredible. And so on top of your career and being a mom, you also are involved in so many things in the community. Most recently, you served as the executive chair for the Go Red for Women for the American Heart Association.
Yes.
Congratulations on that.
Thank you.
That is
Thank
great.
you.
Yes, and that event was just incredible. How was leading that and just kind of seeing your hard work culminate to that amazing day?
Well, first of all, let me thank you and Alyssa for always shedding light on women's heart disease and coming to MCR event.
Yes.
That event is near and dear to my heart because I've seen so many women that may get turned away saying that they have indigestion, saying that they have anxiety. And it's really their heart. So I like to get that information into as many people's minds as possible. Always think this could be cardiovascular and maybe I should check this out, investigate this further. So that event is very special. I will continue to work with them even after my chair year.
Yes.
Yes.
Well, we have to roll into the remarkable side of this conversation because the process is quite a vigorous one to be not only nominated, but then to win out of all the women. We had a lot of applicants submit to our station for this award. And first, how did it feel when you learned that you were actually nominated?
I was so excited. I got a call. It was a personal phone call. And I said, I was nominated for what? My husband did what? So that was shocking. And then he said, yeah, you're one of the finalists. And I just want you to know. And I was beyond excited.
Yes.
Yeah.
Yes. And then the moment that you learned about it and were crowned and your family was there and your husband gave you that sash, that moment, looking at the footage, you looked so shocked, genuinely excited, like, what? This is happening? What were you thinking in that moment?
Clearly the best thing that's ever happened in my life, outside of children and all of that. But it was just so exciting to have that special time and to learn that I was going to be joining these other 112 women in Los Angeles. And I can't even tell you the time we had.
Right, yes. So that's the cool thing about it. You were selected for Northeast Indiana.
Right.
And you met up with everyone else that was selected around the country.
Right.
To meet for this big event. Y'all had quite a weekend. And then the ceremony, the actual award show that was televised.
Right.
On all of Nexstar stations that awarded the Remarkable Woman of the Year. So tell me about that process of being able to fly out and what did you all do?
So this was I think this was my only trip without kids or a husband. So this was very special.
Yes.
Just for me.
Yeah.
And when we got there, as soon as we landed, I had a Fort Wayne connection. My driver is Ty Causey's cousin. He's a famous singer here in Fort Wayne. And then we get to the hotel. They're there to greet us. It's so exciting. All the Remarkable Women signs, a bunch of pink and purple. And then we go right up. We do like a press conference. We talk about our hometown and our market. And then we went to our rooms, which the room was beautiful. And then that night, a poolside party where women danced like I've never seen women dance.
They were free.
They were free. They were free. And it was, one woman had just had a baby that was 3 months old. She danced her heart out. So it was very, very rewarding and special. I will cherish this. Perry Sook, Buzz Levin, Nexstar Media, I thank you.
Oh, that is wonderful to hear. I love that y'all just let your hair down and had an amazing time. And right here we see this beautiful plaque that you received and your own little star of fame.
Can you believe that?
Right.
I mean, that's like the cherry on top because after they did all these special things, which were all surprises, you know, as a mom, as a physician, I don't usually get surprised.
Yeah.
This was a whole 3 days of surprises. We didn't know what was going to happen from minute to minute. So we had been to J HUD Studios. We had gone and toured Warner Brothers. We found out we were going to be on a live show of J HUD. And then at the award ceremony, they gave us our stars. And it's so special.
That is
so
special. And you spoke of J HUD. So the Jennifer Hudson show that airs or records out of Los Angeles, you all were all in the audience,
all
right?
of us. We made up the
cool.
audience. And then the top 5 finalists got to be interviewed by Jennifer Hudson. It was super special.
That is. What a journey, what an experience. Well, we thank you for being remarkable and for being the representation of Northeast Indiana.
Thank you.
We are so thrilled that you got to experience that and you hold this crown for the rest of the year.
Thank you, Jessica.
Yes. Well, keep doing what you're doing, and we're just rooting you on.
I appreciate you.
Absolutely. And if you'd like more information about the Remarkable Woman competition that happens annually for WANE 15, we'll have more information on our website, and I'll see you after the break.
Follow us on social media at Living Local 15.
This segment sponsored by Kevin McIntyre, a licensed insurance agent with Health Markets Insurance Agency. Welcome back to our Medicare Because We Care series, where we speak to licensed insurance agent Kevin McIntyre from Health Markets Insurance Agency. Good morning, Kevin.
Good morning, Jessica.
How are you?
I'm great. Good to see you again.
You too. Okay, so we've rolled out this series,
Yeah.
and I understand that people have been submitting questions.
Yes, which is great.
Yes, so exciting. Okay, so as we have covered the different Medicare topics over the past few weeks, this is just a reminder. People can actually submit their questions to you
Yes.
via the email that's listed below. And today's question actually comes from Tina. Okay, are you ready?
I'm ready.
She asks, can you explain the difference between Medicare Advantage and Medigap plans?
Absolutely. That's probably one of the most common questions that we get because people do have that choice when they enter Medicare. The first thing we start with is we want to make sure people understand that they need to have Part A and Part B in place, which we've talked about on previous episode, before they're eligible for either a Medigap plan or Medicare Advantage plan. So that is the foundation. And once you have that in place, then you have the choice. But let's start with Medigap.
Okay.
So Medigap is also known traditionally as a traditional Medicare supplement. Traditional Medicare supplements work directly with Original Medicare to cover some of the costs that Original Medicare doesn't cover. So things like coinsurance, co-payments, deductibles. They're offered by private insurance companies. Again, they do work with Original Medicare. And then it's also important if you have a Medigap plan that you also include a drug plan on top of that because those plans don't include drug coverage.
Okay.
So we do need to add that on top as well.
And how does that differ from Medicare Advantage plans?
Okay, so Medicare Advantage plans work a little differently, and Medicare Advantage plans are also known as Part C. So if you've ever heard of Part C, that's the same thing as a Medicare Advantage plan. Medicare Advantage plans are also offered by private insurance companies as an alternative to Original Medicare. They include Part A, Part B, even Part D in a lot of cases. The drug plan is wrapped in. An important thing to remember, though, with Medicare Advantage is that they do operate with networks of doctors and prescriptions. And so it's very, very important when you're enrolling in a Medicare Advantage plan to make sure that the doctors you see and the prescriptions you take are within that company's network and formulary.
Okay, yeah, so they both sound like really great options. So how do you go about helping people decide between the two?
Sure, you're right. They are excellent options. And as I'm educating somebody, as I'm listening to the answers they're giving me, I'm really encouraging them to let their peace of mind guide the discussion. Everybody's different, every situation is different, and so there's really no one size fits all for everyone. But things to consider are that a Medigap plan usually will carry an additional premium above and beyond the Part B premium. But when you go to use your medical care, your out-of-pocket costs are usually lower. Whereas with a Medicare Advantage plan, you could have very little to no out-of-pocket for the plan itself, but then you do participate with co-pays as you use medical care. It really is a person-by-person, case-by-case basis, and we really just let their situation dictate what's best for them.
Right, and that's why it's so important to have a local agent like yourself to help people along the way when making those decisions.
Yes, and we absolutely love what we do. We love to see the light click on, and as people are getting educated, just helping them make that decision is very rewarding.
Right,
So,
well, thank
enjoy
you
it.
so much,
Yeah.
Kevin. That was really great information, and you all remember you can actually email Kevin your questions, and it may get answered on a future segment. And if you would like more information about Health Markets Insurance Agency, we'll have their website listed below, and we'll be right back. This segment sponsored by Kevin McIntyre, a licensed insurance agent with Health Markets Insurance Agency.
Living Local 15, proudly driven by the Kelly Automotive Group.
Hi, I'm Karen Fursell with bestreviews.com. Make sure to take out your phone and scan that QR code. We're gonna unlock some great deals today. We're talking about beauty at home, and one of the products that I love is this at-home beauty spa. It comes with so many accessories. It takes you out of the spa. It saves you so much time and money. You've got the very trendy headband, the steamer, you've got the roller. It allows you to really infuse your skincare, and it's something that it's a no-brainer for me. I use it all the time. The next product we have is by Nuvadermis. This is an advanced scar gel. This is made with really great ingredients that are gonna hydrate your skin and really help get rid of those scars that you might have accumulated over time. It's something that you can do at home. You do not have to go to the dermatologist. And this is a product that did really well in the Best Reviews testing lab, so we swear by it. The next product's by Luma. It is something that I use every day. This is 72 hours of odor control. This is a whole body deodorant. Let me just tell you something. The scents are great. It comes in tangerine, a lavender, and unscented. It doesn't leave any residue on your skin or on your clothes. I absolutely swear by it. And finally, we have by Oraglow. This is an at-home teeth whitening kit. We all want that perfect smile for the holidays, and this is how you're gonna get it. This is something that uses blue light technology, which means it really, really works. You're gonna take the gel, you're gonna put it into the tray, and then you can just watch TV, which is what I do. And you can really whiten your teeth to like 2 or 3 shades lighter, but it's gonna look natural and you're gonna look perfect for the holidays. Well, let's take a look at all 4 products that we had today in our Beauty at Home segment. Be sure to take out your phone and scan that QR code. We want to unlock some great deals and get ready to scan, shop, and save.
Best Reviews is owned by our parent company, Nexstar. You can find more on the products and where to buy them on WANE.com.
Go to the Living Local 15 page on WANE.com for recipes from the show, to watch a segment again, and to get information on products and services featured on Living Local 15. Content segments during today's Living Local 15 were paid for by these sponsors.